Namaste. Today in this heartbeat episodes, we are going to discuss regarding the heart diseases and symptoms in the women. Many times people ask from us, the heart attack symptoms are same for ladies or we can say female or what we see in the male. So let us first know what are the heart attack symptoms as on which we diagnose. So chest pain or we can say angina, this is the first complaint most of the time the patient of heart attack will be having. And this heart pain is somewhat different, and I always say and I will always educate my patient to know about it. So for them, I am repeating it, the pain which is coming in front of the chest means front of something pressing, and the sensation is going in your hands or to the jaws or up to your umbilicus. This is a typical complaint that patient will say, and it is a lifetime, means something which they never have felt, and mostly they will start feeling sweating also, somewhat warm sensation will be coming, and the time they start walking they feel that this pain or this sensation is increasing, and the time they take rest or they are sitting it may reduce. So these are the three characters: heaviness, which is increasing on walking and relieving on rest or relieving on taking sublingual sorbitrate, is a symptom of heart attack. Or you can say, and this is if it is happening in the resting, it is a symptom of heart attack, and if it is happening in your day-to-day activity after a particular workload, or you can say after walking 1 kilometer you are getting this sensation, then we call as a angina. And this is a very typical complaint of coronary artery disease, means your coronaries is having somewhere blocks and which is compromising the circulation of the heart, and this will have a, we call as a particular threshold, means some patient will say that when we are walking for 500 meter I am getting, somebody will say I am getting on particular 1 kilometers, and they have modified their life or they take rest, and after that they are continuing this activity. So when this symptom of angina, what I have described, it is happening when you are in the resting stage and it is not reducing, means it is progressing further, it is a medical emergency, and we have to immediately rush to the nearest center where the cardiac facility is there, and the basic minimum is the ECG. ECG will give a lot of clues, and after that there we are having tests like TROP-T, CPKMB and echocardiography. These are the just other tests which will certainly add the values whether you are having heart attack or not. So this is the regarding the heart attack, which usually patient should know or everybody should know how to self-diagnose that you are undergoing this type of medical emergency. Coming to the second part, the women will be having the similar symptom. Most of the time their symptoms will be like what I have described, but usually some females, or you can say female, may be having some vague complaints. Their complaints may not be like a typical angina, it may be back pain, it may be the pain in the hands, or the patient may be having called angina equivalent, they may be getting more breathlessness. So ladies are having the similar angina like complaint, but they may be having a some vague complaint which should be always evaluated. If they are complaining that I am getting some breathlessness, some tightness, and it is increasing while walking, it may be a feature of heart attack and it need to be evaluated. But most of the time the hormonal imbalances usually which happen during from menarche to menopause also give the similar type of tightness in the chest, and that's why the females are mostly neglected for their complaint. They think that probably this is a hormonal imbalance, but anything which is persisting, progressing, it has to be evaluated, and in that scenario ECG and a cardiologist's opinion will certainly make a difference, particularly when you are having risk factors. Risk factor means if you are having a family history of heart diseases, if you are a diabetic, if you are a hypertensive, or if you are having the lipid abnormality like a cholesterol, high cholesterol value. These are the features which will, if we are present, even though you are not in the menopause, you may develop the heart related problem or heart attack may happen. So symptoms is very important. After that your risk factor, and in light of these risk factor we have to see the ECGs and other diagnostic evaluation. And the complaint of vague complaint of chest discomfort or the right hand pain or breathlessness should never be neglected in the females, particularly if they are having risk factors, and in that scenario we have to evaluate the patient and diagnose it. So in summary, females are also having the typical complaint of heart attack, what we call as angina at rest, but on top they may be having vague complaint of abdominal discomfort also, vomiting also, sometimes pain in on the back region, or pain which is not directly related to the activity. That are also complaints which are described in the females who are having the heart disease or who are developing the heart attack. Thank you so much for watching. We will see you with new topic in the next episode. Jai Hind.